Dear student, I am Dr. Prakash Mungli, Professor of Biochemistry. So in this lecture, I will be going over disorders of amino acid metabolism, more particularly Alkaptonuria. Let's get into the details of Alkaptonuria. Alkaptonuria is also referred as black urine disease or black bone disease. Make sure you remember the term here. Black coloration is seen in Alkaptonuria, and why it is called as Alkaptonuria? Because alkaptone bodies will appear in the urine, and these alkaptone bodies are colored molecules when they are oxidized. So let's look into some more details in that aspect. So earlier, when inborn errors of metabolism was explained by a scientist called Garrod, Alkaptonuria is one of the disorder that was explained along with other disorders, cystinuria, albinism and pentasuria. So Alkaptonuria is part of Garrod's tetrad. So in Alkaptonuria, the deficiency of enzyme homogentisate oxidase is known. And deficiency of homogentisate oxidase, which is also referred as homogentisic acid oxidase or homogentisic acid 1,2-dioxygenase, is the same name. Homogentisate oxidase, also referred as homogentisic acid 1,2-dioxygenase. So what this enzyme does? So homogentisate oxidase enzyme, it is involved in the catabolism of tyrosine, as we have seen in our earlier lectures, in the conversion of phenylalanine into tyrosine done by tyrosine hydroxylase. Tyrosine undergoing catabolism, undergoing a transamination process into 4-hydroxyphenylpyruvate, and 4-hydroxyphenylpyruvate converted into homogentisate, homogentisate converted into Maleylacetoacetate, Maleylacetoacetate converted into fumarylacetoacetate, and fumarylacetoacetate breaks into fumarate plus acetoacetate. This is how the metabolism of phenylalanine and tyrosine goes, especially the catabolism. Okay, so here in the conversion of homogentisate into Maleylacetoacetate, that will be done by an enzyme homogentisate oxidase, HGA oxidase, homogentisate oxidase enzyme. So defect or deficiency in homogentisate oxidase will lead to elevation of homogentisate, and that homogentisate will be diverted into benzoquinone acetate formation, and this benzoquinone acetate, it has got higher affinity for cartilaginous tissue. It will go and bind to any tissue that contains cartilage, and also presence of benzoquinone acetate in the body fluids. Upon exposure to air, they are oxidized into black alkaptone bodies. So there will be black coloration or slate gray or towards the black coloration is seen in this particular condition. So that is what I am explaining here. As you see in the slide, so accumulation of homogentisate in tissues and body fluid occurs, and excretion of homogentisate, which is an uncolored hydroquinone in the urine, and this uncolored hydroquinone may oxidize in the urine upon exposure to air to become black alkaptone bodies. And homogentisate can be auto-oxidized to benzoquinone acetate, which is a quinone derivative, and this benzoquinone acetate, it has got higher affinity for cartilaginous tissue, thereby it will darken the tissue. So the hallmark of this disease is passage of urine that becomes black when left standing because of oxidation upon exposure to air, and the black urine that a patient sees in the bowel there, so will frighten the patient, and that's the one which will bring patient to the physician's attention. Not only that, like homogentisate conversion to benzoquinone acetate, it is polymerized to become black alkaptone bodies, and that will accumulate over cartilaginous tissue, and that will change the cartilaginous tissue. So the benzoquinone acetate has higher affinity towards cartilaginous tissue and hence accumulates over cartilaginous tissue. So the oxidized pigments are deposited in the bones, connective tissue, sclera, skin, and in other body parts, and that type of feature which is seen here in Alkaptonuria, it is called as ochronosis. So Alkaptonuria is an inherited cause for ochronosis. So ochronosis can be because of acquired causes, because of use of hypopigmentation agents which contains quinone derivatives, or it can be ochronosis can be inherited ochronosis, and the cause for inherited ochronosis is Alkaptonuria. Now, because of the accumulation of alkaptone bodies, it will lead to slate, blue or grey or black discoloration of the sclera, ear cartilage. It's indicative of widespread staining over the body tissues. Hips, knees, knee joints, intervertebral discs are commonly affected, leading to low back pain. And pigmentation of the heart valves, larynx, tympanic membrane and skin can occur. So the diagnosis should be suspected when a patient's urine darkens to blackness, and that's one of the early signs that help in the diagnosis of Alkaptonuria. Vitamin C supplementation is recommended to decrease the formation of homogentisate, because conversion of 4-hydroxyphenylpyruvate into homogentisate needs that vitamin C. And drug nitisinone, which is inhibiting 4-hydroxyphenylpyruvate dioxygenase enzyme, thereby homogentisate accumulation is decreased. So this nitisinone, which has been designed for the treatment of type 1 tyrosinemia, is also tried in Alkaptonuria. So this is all about a disease called Alkaptonuria, one of the disorder which is connected to catabolism of tyrosine. Thank you.